This is Krista. Welcome back to MadeToBeWhole. Stay tuned for this week's episode discussing frequently asked questions about IV therapies.
MadeToBeWhole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on MadeToBeWhole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
So welcome back. We're going to talk this week about IVs. We get a lot of questions about IVs. There's a lot of information and misinformation, lack of understanding, partial understanding about when IV therapy could play a role in your healing, what it's beneficial for, what it's not beneficial for. One of the things I remember learning at my first ILADS conference that I've always remembered was several doctors who have been treating for a long time standing up and saying, IV treatment really for most people isn't necessary. The majority of people can get well with primarily oral therapies, and they're talking specifically about antibiotics. So let's start first with IV antibiotics and when those would be something to consider. So they're not for everyone. They can be a bit of a hassle. They're obviously more expensive, but occasionally you have someone who is going to have better outcomes with IV therapy. So I'm going to give you examples of a few scenarios in which I've used IV antibiotics successfully. One thing for you to realize, though, if you are going at this and want to include this, like everything else, for the majority of people, there's not going to be one treatment that takes care of everything. I've had people say, I know if I can just get those IV antibiotics, everything will be better. And most of the time, unless this is very early treatment, it's not going to take care of everything. It might move the needle, it might be helpful, but you still have to do all those other things to address immune system dysfunction, inflammation, toxin removal, taking care of yourself emotionally, spiritually, physically. People that I've used IV antibiotics successfully on were people who were not responding to oral antibiotics and their symptoms were worsening despite treatment. I think of a patient who was on oral therapies and the swelling from Lyme arthritis kept increasing despite aggressive oral therapy. This person, we went to IV therapy and that took care of it successfully. I have some people who will choose to do that route because of severe GI symptoms and a lack of tolerance to oral antibiotics, maybe some absorption issues. Something that you need to remember, though, is that even though certainly oral antibiotics will impact the gut more, sometimes what you experience as far as GI symptoms or quote unquote side effects with oral antibiotics are actually die off in the gut. So because these infections can go anywhere blood flows and takes them, you can have symptoms anywhere. So you can have inflammation, we've talked about extensively on other episodes, in the brain. You can have inflammation in the blood vessels. You can have neurological inflammation. You can have inflammation in the joint and soft tissues. But you can also have infection and inflammation in the GI tract, so in the stomach, the colon, anywhere along there. So if you're having die-off, those symptoms could temporarily get worse before they get better. One of the things that we need to do to kind of parse out what's what is, first of all, make sure that no matter who you are, if you're using antibiotics of any kind, you are aggressively supporting yourself with really, really good probiotics. Probiotics are super important. I have heard a few people say it's pointless to use them during antibiotic therapy. It just cancels itself out. And I would vehemently disagree with that assessment of things, both from just a practical standpoint, from experience, but also kind of an academic standpoint. So, of course, there's going to be a little less absorption of probiotics if you're using antibiotics, but just academically, we have to go back to timing. So first of all, you want to make sure that you're taking your probiotics at least 2 hours apart from your antibiotics. It's nice if you can take it at bedtime, so they're working overnight, because some of that is going to be quote unquote canceled out by the antibiotic therapy. It is imperative to use higher doses. So that's why I recommend people doing antibiotic therapy take at least 100 billion CFUs. The doses of antibiotics are given in CFUs, these colony forming units, instead of milligrams. So you want something with multiple strains that is at least 100 billion. I know personally, I tried some cheaper brands first just because I was being cheaper, even though they supposedly had 100 billion CFUs. When I switched to one that was pricier, because high quality, high potency probiotics are expensive, but immediately I had relief of GI symptoms when I switched. Absolutely immediately. I also recommend that people take Saccharomyces boulardii, which is another prebiotic strain that can help with preventing yeast. So that can offset some of those symptoms. So yes, it's your antibiotic canceling out some of your probiotic. Absolutely, but not all of it. And you are being aggressive with high quality, high potency probiotics to counteract that, and you will be better off. People who have come to me and say, oh, my gut was destroyed because I saw someone else for a few years and they gave me all of these antibiotics. When I ask them if they were using probiotics, invariably they say no. So I think that that's really, really, really critical. And just from a practical practice standpoint, my patients feel better when we find the right probiotic for them. We have a really great one on our store website called Ultrabiotic 100. It's our label of Orthomolecular's Orthobiotic 100. For the majority of people, that works fantastic for these situations. Occasionally, we have someone who we have to either double the dose on or use something different because that one does not agree as much with their body. When you're on longer term antimicrobial therapy for infections, don't tell me, oh, it's fine because I have yogurt every day. Go ahead and have your yogurt. It's not enough, though. It's not sufficient. That's great for daily gut health, some of the things we can do through diet. We always want to support our whole body through diet, but you have to remember this is a different circumstance and that's not going to be sufficient. So that is one argument that is sometimes used to use IV antibiotics, would be the lack of GI tolerance to oral antibiotics. But as I said, just to make sure that it's not die-off that you're dealing with and that you're giving the appropriate gut support, because you need to do that no matter what. If I switch you to IVs, you still need really, really good probiotic support. Some people find IVs to be convenient. It really depends on your life situation. Some people are very overwhelmed by pills. Nothing feels good going down. They may have problems just breaking things down, digesting them, absorbing them, and they are open to IV antibiotics. But I have to tell you, we do a fairly careful screening process, and I'm getting a little more picky before I would consider someone for that therapy, because there's so many things that you have to logistically take care of. So I would venture to say that most people, I'm not going to sign up for this therapy unless I'm sure they're cognitively 100% able to manage all of the complexities of management and self-care on their own, or they have an informed functional support person in their life who can help them with it, because there are a lot of practical things that need taken care of on a regular basis. So let me go through and describe the different kinds of IV access, what the process is for getting those things, and what it would take to maintain them at home. So a peripheral IV is what most people are familiar with. Usually it goes in the hand or the arm, sometimes in the antecubital space, which is that little crease in your elbow. It's what they will put in the hospital if you need a bag of fluids or you're there for a short period of time. Peripheral IVs can stay in the arm for up to 72 hours, but that would still need to be flushed and maintained, and you make sure it doesn't get displaced. It's not really suitable for at-home administration of medications, even though if you were getting them in a clinic, that could potentially be done. A step up from a peripheral ID is a midline catheter. It's a longer IV that has to be placed at the hospital or a vascular access center that goes in your arm, but it's not a short little tube. It's a longer one, and it can stay in for up to a month. So that is not a bad choice if you're just trying things out. Or I have occasionally had individuals who have, say, really severe bladder infection or respiratory infection that's not responded to other treatment. We'll need to treat them for weeks, but not for months. So a midline catheter is not a bad option at all. The third one, which many have heard of, is called a PICC line, and PICC is PICC. It stands for peripherally inserted central catheter. So it goes in one of your arms, but it's long. It's threaded up your arm on the inside and around to near the heart. So it's a central catheter. That means a central line. We're going to the heart, to those big blood vessels, but it's peripherally inserted. So this has to be done, again, typically at a hospital or vascular access center. And then after it's in, the person doing it either does an ultrasound to verify that the tip of it is in the right place, or they might send you for a chest x-ray, and the chest x-ray can confirm that the tip of the catheter is in the right blood vessel. So PICCs are really, really cool, but they do take a lot of maintenance and care that cannot be ignored. So you still shower. Now, because you've got this thing sticking out of you, you can't take a bath, you can't hop in the pool, you can't just hop in the shower without wrapping it. You can use things like saran wrap, but they've got some really, really cool shower sleeves now that anyone can purchase on Amazon that you just pull up over the PICC line, and it's waterproof. Those work really, really well. You have to be careful about it being caught on things. Now, they have PICC sleeves that you can wear over your PICC, and it kind of folds it in there and protects it. I completely think those are fantastic. They help quite a lot. But you also have to look at, okay, but what is my lifestyle? Do I have the type of job where I'm using my arms a lot and it could theoretically get caught or bumped or displaced? It might not be practical. Do I have little kids who grab at everything? Is it reasonable that it's not going to get snatched or pulled? Am I an older person who maybe is prone to falls and catching things? My balance isn't good. Yeah, then that makes it a little more risky, and we don't want to do anything like this if it can't be really safely maintained. One of the other things that's imperative with a PICC line is that you have to have weekly sterile dressing changes. So this needs to be done by a registered nurse. You have a couple of different options for this. You can go to the hospital. If you have insurance, we can write an order, and frequently, not all the time, but frequently insurance will pay for the PICC care. You go in once a week. They do the sterile dressing change. No, we will not teach you to do it by yourself. No, you cannot do it at home. You do the sterile dressing change. A lot of care has to be taken to make sure the PICC doesn't get displaced at all. They have to replace the end pieces of the lines. They're flushing, making sure it's patent, doing a lot of assessing for us. So one option would be to go someplace like an infusion center or a hospital. Very frequently, we will use home care agencies. A lot of infusion pharmacies, particularly if you're doing IV antibiotics through an infusion pharmacy, frequently those infusion pharmacies will have home care nurses that are able to do those weekly dressing changes, which I think is great, because the downsides of going to the hospital are you're around sick people. So I don't really like people to be around really sick people. They don't have to be. You're not there to catch something. But then the other thing is, because of staffing, you can have a bunch of good nurses, but you're very frequently seeing a different person every week. And sometimes it's kind of difficult for patients. Plus, people kind of get to know you, your skin, the way it responds to the dressing, just the whole situation, and it's not like they're relearning you every single week. So I like home care because there's usually more continuity of care, less germ exposure. The fourth option is a port which is a type of central line. You may be aware of this if you know someone who's had chemotherapy. A lot of cancer patients will have ports. It is inserted surgically under your skin and your chest. They can do it a couple of different ways. They can put you asleep, which I would prefer to be asleep if something were being put in my chest under my skin, but sometimes they will just numb people and do it in an office. The really cool thing about ports, depending on your lifestyle, your situation, how long you're going to need it, is that a person can be taught to manage their port at home. So what it is, it's going near those blood vessels of the heart, like we talked about with the pick, but it's much closer to the site. And what there is underneath your skin, there's like a squishy pad that accesses it. And so when you go to access your port, it has to be cleaned really well. You scrub it down with sterile solution. The area has to be clean. Your nurse is wearing a mask and you're wearing a mask. Eventually, though, people who have ports long-term can learn to access and do this at home, or their family member can, because it's cleaned down, you mask it, and then there's a needle that's actually not that long. It looks like a hook. It's just a little curved needle called a Huber needle that goes into that area and then gets sealed on. There's a tube that comes out of it. Blood can be drawn out of it. Medication can be put into it. When it's accessed, it means the needle's in and you can get it. But then when it's de-accessed, if you have days when you're not getting IVs, that can be taken out and you can do your regular activities and you can go swimming and do other things. So it gives you a lot more freedom. And obviously you don't have as many fears about things getting caught on it. As long as someone's using sterile procedure, all of that, you can do life kind of as usual. To some people, it sounds really dramatic. For other people, it's a dream. My oldest son actually got a port in December because he has autoimmune encephalitis. We knew he would need IVIG, and he has horrible veins. Horrible peripheral veins. And on top of that, because of sensory issues, blood draws and IVs are just horrible for him, like super traumatic, difficult emotionally, can't stand the feel of it. IVIG is like a really long procedure. So he had the port placed and has really liked it a lot because, first of all, blood draws are no longer traumatic. They're a lot easier. He can get his IVIG through it. And then we're also doing a rotation of IV nutrients at home. Now, all of these things, when they're not being used, have to be flushed with saline, normal saline, 0.9% sodium chloride. So you're flushing with that. And then unless there's a heparin allergy, we're also putting a small amount of heparin in that line so it doesn't clot. Heparin's a blood thinner. In large doses, yes, it could cause bleeding in people, that sort of thing. But we're using just the amount to fill that line so that no clots develop and it can maintain use. So once you have figured out what type of access you want with an IV, let's talk about the options for what can go in through that IV, either at home or in a clinic. So my experience has been, for those of you with insurance looking to use your insurance, I don't typically have difficulty getting insurance to pay for a PICC line or a midline or even a port to be placed. Most of the time, most insurances will cover that. But what you do need to look at is the cost of what goes in it, because I have a much harder time getting that covered. And so you need to be cognizant of what's covered by your insurance company, what the cost of treatment would be, and what you're willing to spend. So IV antibiotics, let's talk about that first because we have a lot of questions about that. There are only certain medications that are FDA approved for Lyme disease, and depending on the insurance plan, they may have built-in limits regarding how long those can be used. So they may say, yes, you can use IV ceftriaxone for 28 days and we'll pay for it. If somebody just got bit, that may be sufficient. If they've been sick for a long time with neurological symptoms, they're probably going to need multiple antibiotics and for a longer period of time. So you need to be aware going into it what your potential costs are and if it's something you're able and willing to bear, to take care of. One thing you have to recognize is that certain things, as far as your insurance company goes, are going to be shut out for coverage if they're not the standard of care. And we know there isn't a great established standard of care for chronic infections. So we have to take what we can get. This is my personal philosophy. If you need and want this therapy and your insurance pays for anything at all, be grateful, take it and run, and don't sweat it. Don't waste energy on things that aren't covered, because you're honestly blessed that anything was covered. And then we just go from there. Which antibiotics can be used for Lyme or Bartonella with neurological symptoms especially? Those are another group of people that I feel like benefit maybe more than others from some of the IVs. So ceftriaxone, which is Rocephin, I mentioned, that frequently can go through insurance. Ceftriaxone, one thing that's important to know is that it can cause gallstones if administered too quickly. So even though some insurances just want to pay for a syringe that we do what's called IV push, we just push it through the line, that increases your risk of gallstones. So I like it to be run over an hour and 100 milliliters of saline. And I also have people take Ursidile, which is a prescription while they're on it to prevent gallstones being precipitated. Azithromycin can sometimes be added. Azithromycin is the generic name of the medication that's found in Zithromax. Azithromycin does have some impact on Lyme borreliosis, but it also does a lot for Bartonella. What you will typically do, though, is you'll start with something a little less potent. Once you're dealing with that and not herxing, then we add an agent or swap something else out. I think that is the preferred way to do it. If you start too many things at once, whether they're IV, pills, other modalities, you're not going to know what's working and what's not. And you're not going to know if one thing's causing a problem and you started 3 things at once, how do you know what it is? You don't. So a lot of this is really dependent on your symptoms, how long you've been sick, which infections you have, what's been tried, what you tolerated, what you didn't, your finances, so many different things. Some of these things can be run really quickly. So for example, if you do that IV ceftriaxone and 100 milliliters of saline, you just hang that puppy up. I do it over an hour, which just for caution, but an hour is not that long. You can just do it while you're doing whatever, watching TV, reading a book. One of the coolest advances are something called elastomeric pumps. They're these little plastic balls that they have your medication in them. It comes with a line attached, and the medication is in the ball, and the ball is basically programmed to run at a certain rate. So if I tell them I want 100 milliliters over an hour, they're going to send you a 100 milliliter ball that's programmed. Once you attach it to your IV, it's going to run in an hour, and then it just shrivels up, and you unhook it and flush it, and you're done, and you throw it away. And it's nice because you don't have to have an IV pull. You can have that ball sitting on your lap. If you have a fanny pack or a backpack, you can throw it in there and be doing your other stuff. I think elastomeric pumps are the ideal delivery for most medications and most people. Some meds you have to mix like right when you start them, so you can't. Where do you get that? Some pharmacies will just provide it if we ask, but I've also found that some infusion pharmacies and some insurance plans don't like to provide the elastomeric pump because it's not as cost effective for them. One workaround that we have for this, and this would actually be my preference if I had a magic wand and could just wave it, is that if an individual was getting IV antibiotics, that they would go through a specialty pharmacy like InfuServe America. We've had Randy and Carrie on the show before from InfuServe. They're a Lyme specialty pharmacy who basically their origins, I believe in the 90s, were providing IV antibiotics for Lyme patients and providers who are treating them. So they have very, very fair cash prices. They send everything in those balls that they can. They have amazing customer service. They don't hassle us about the things that we order. They understand these patients, what they're going through, what they're treating, and provide an immense amount of support. And even though they are out of network with insurance companies, they do have a department that will help you file for out of network reimbursement. So if that's something that is an option, it is far and away like the way to go. Everything gets delivered, it gets shipped to you. The customer service is so good. I think it's the better way to go, and it will decrease your stress dramatically, because when we're going through some of these other infusions pharmacies, we have a couple of unique challenges. First of all, I can't just say, oh, there's this one infusion pharmacy that takes insurance and they're great, and so we'll just use that for all of our Ohio patients. Unfortunately, that's not an option for me, because every insurance plan has a different pharmacy. And on top of that, they have a different infusion pharmacy they cover in each county. So I can't even say, oh, all of my Ohio CareSource patients, I'm just going to send to X pharmacy and I'll get shipped. No, it depends on what county you live on, what's going to get covered. And then within those pharmacies, you have different policies, different people running it, different degrees of difficulty in getting the care and service we need, different degrees of cooperation. And it can be such a hassle for you and for our office, and takes hours of time getting things to be done correctly. So I know it's not an option for everyone, but anyone who has the opportunity to use InfuServe, or if you find a similar place when you're doing IV antibiotics, I think that you'll find that the clinical excellence and support is just outstanding, and will be a lifesaver for you. And they've got 24-hour on-call pharmacists. I could go on and on and on, but that makes the experience so much better. Now, outside of IV antibiotics for infections that respond to antibiotics, because remember, not all infections do. So babesiosis is caused by a parasite. So yes, it's true, azithromycin is sometimes part of a babesia protocol, but somebody is typically not going to need IV azithromycin for babesia treatment, because so much of what we're doing are other modalities that don't go through an IV, and the azithromycin's kind of a little extra boost. It makes that atovaquone more potent. But there are things other than antibiotics that you can do with an IV. I mentioned before IV nutrients. Now, I know everybody loves to tell me which IV they read about is just the best for energy. Well, I talked to ChatGPT, or I talked to my friend, and everybody needs a Myers cocktail, or it said, I just need some B vitamins. I'm telling you, I could do that for you, but I think it's risky and it's a waste of your time and money, because are some people tired because their B vitamins are low? Yes. Can you have adequate B vitamins and not be tired? Yes, because there are other things that can be driving it. So I personally think that IV nutrients are almost a waste of money if you don't do good nutrient testing first, because you will easily spend that amount pretty quickly on IV nutrients that may not be what your body needs. If I can make you a customized treatment plan based on those nutrient results, and you're going to have much, much, much better outcomes. Some of the things that I've seen be most beneficial for individuals as far as IV nutrients go, when it correlates with their deficiencies, not just for everyone, but we find not uncommonly alpha lipoic acid deficiencies. Alpha lipoic acid, it's an antioxidant. It affects a lot of processes, including blood sugar regulation, but we found that it can help a lot with neuropathy and related symptoms. So if I have patients who have fatigue, pain, neurological symptoms, and they've got low or suboptimal ALA, just the abbreviation for alpha lipoic acid, I will use that. I typically start them at a lower dose, because if you start someone too hard and too fast, it's just, there's too much going on in the body. It cannot feel well. So we work you up to the full dose. Most people do well with that as long as we take it slow enough. There's a lot of talk about IV glutathione. Oh, IV glutathione's great. It's the best. Glutathione is great. It's an antioxidant. It's amazing. We love it, but not everyone needs it. Some of the people who do, you might make too sick giving it to them right away, because they have vitamin C and other things out of balance that we need to get kind of optimized first before they can handle the glutathione. So even with that, I am cautious and typically start people with a lower dose, because if somebody herxes or has some sort of detox reaction on a low dose, we don't want to push that any higher. Granted, some people do really well at higher doses, but we want to use some caution. You do have some alternatives to glutathione that are not IVs. So, for example, topical glutathione has been shown to be really helpful. You can do nebulized glutathione, a lot of different ways to explore that short of an IV, unless you already have IV access and it helps you. You can do minerals. You can do carnitine. We find a lot of people with impaired mitochondrial function, low carnitine can be part of that. IV carnitine is a really, really great option too. There are a lot of different nutrients. The key takeaway is you need to know what your body needs so that you're spending your resources wisely and we're optimizing your outcomes. There are some other things you can do with IVs as far as treatment goes, like IV artemisinin, which is an herb that can help babesia. Now, granted, I am only aware of one licensed pharmacy who provides this. You have to be very, very careful when you're putting things into your body that whoever you're ordering from is using verified good pharmacies. You don't want to be putting anything into your system that's not great. But we found a pharmacy that we're able to get that from. It's the same place we get IV Procaine. Procaine is anti-inflammatory. It can help with pain, with neurological stuff. We have found it to be very, very helpful in mitigating the symptoms of autoimmune encephalitis, which is PANS PANDAS, while waiting for IVIG or plasmapheresis or the longer-term treatment that's going to turn things around. I personally do IV Procaine weekly. I always tell people I feel my head shrinking. The neurological inflammation reduces, my legs feel lighter, everything's better. I tried going without my weekly dose because I thought maybe I don't need it, and I just do until I can get the plasmapheresis that we have coming for the encephalitis that I have. It's just become part of my management. Is it cheap? No, but not being able to work is pretty expensive too. So we do what we have to keep going. One of the things I need to make people aware of, just kind of as an end note, we have had some calls from people who are understandably desperate and really, really sick, and they want us to just do certain things. You know, all you need to do is order this and we'll take care of everything at home. And I'm not going to come have your nurse do the dressing changes, or I'm not going to go to the hospital because I have a friend or a cousin or XYZ, or we can learn it. And I want to tell you that that's not a great approach for a couple of different reasons. First of all, we worry about your health and safety, and we're also taking on a lot of responsibility and liability when we do treatments like this, especially when we do them in the home. We will allow people to do home treatments as long as we have the follow-up set up for their dressing changes, for their routine labs, the regular visits in the office, all of those sorts of things. But just recognize nobody is trying to be stingy with you or wants to keep you not well. We just want to get you well in the safest way possible. And in our experience, even though it sounds like a great idea for everyone, first of all, not everyone needs it. A lot of people can get better without it. And even those who do, they need to have the right support system, the right physical environment at home, the right financial resources. Otherwise, it could be a problem instead of a potential cure. So keep that in mind. We want to help you in whatever ways are best, but we want to do it in the safest way possible. If you have other questions about IVs, feel free to reach out. If you're interested in just IV nutrients, you can do a Bridge to Foundations program, which is just meeting with our provider, doing the intake and doing the nutrient test, CBC, CMP, just some basic things. Because again, we could say, hey, IV nutrients are a trend. We're just going to open a med spa and let whoever wants come pick from a menu what IV nutrient they need. But that's not how I practice. I want to give you what your body needs. I don't want you to give you too much of something. I don't want to give you not enough of something. I want to customize your care to improve your outcomes, and paying for a couple of IVs that weren't what your body needed covers that test. It covers it right away, and it's going to save you time and save you money. So IVs, they're not a cure-all, but they can be a great tool that you add to your arsenal of treatment. Just be cautious about who you're getting them from and recognize that it is a big commitment on your part. But if it's what it takes, it's what it takes. I would recommend, before anyone did something more dramatic like a port, that they first try some things peripherally to see how they respond and to see if it's something that would be a benefit to them before you move to the next step. So feel free to send us any questions you may have, any specific questions about IV therapies you'd like addressed. And remember to have hope, because you were made to be whole.
Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.